My name's Iliada Papachristou. I'm the project manager for 3DLC. I'm also a health psychologist and I've been working within research for the past 8 years. The 3 dimensions of care are psychological, social and physical. So the idea is that we're integrating psychology and social welfare within physical health. Currently, the patient would see their physician about their long-term condition, and if they did have a mental health care issue, they would be referred probably back to their GP or, for example, across the road to the Maudsley Hospital, which is a mental health care hospital. And what we want to do is join up the pathway so they're seen and triaged by both mental health and physical healthcare clinicians. So we've learnt from the diabetes project, the 3D, 4D project, that they had significant physical and psychological improvements. And the idea with this particular project is that we're scaling up to other long-term conditions such as heart failure, COPD and hypertension.
When you've got patients who are struggling with their diabetes, struggling to get on top of things, we're actually able to do something positive, which is say, okay, we recognise that there may be social or psychological barriers, and why don't we actually focus our attention on clearing those barriers, and then once that's done, maybe we can get to the diabetes a bit better. When you had the diabetes physician working in conjunction with the psychologist, that really kind of was a greater than the sum of the parts story.
Perhaps professionals tend to split people's lives into different aspects, so maybe their physical health, their mental health, their social situation, but that's not how people view their own lives. They view their lives as a whole. And everything has an effect on everything else. Within the diabetes programme, Thames Reach provided the practical and social support element. Practical issues such as housing and where people live, having stable housing, their finances, whether they have enough money to live off, can make a huge impact on people's lives.
I really hope that through sort of work happening here that other units can adopt these sort of ideas. You know, the 3D, 4D project won national awards on this, and then of course there are learnings from our diabetes specific project to other long-term conditions.
This would be very beneficial in terms of saving time and resources. This could be quite cost effective as well.
Having all the different strands in one place instead of being separate and in different services is hugely positive for the NHS.